Hello, listeners and viewers. We're right here at Reverend Father Peter Konteh's office, and we're doing a brief interview about his work with the Desert Flower Foundation Sierra Leone. Father Peter Konteh has been working with Desert Flower Sierra Leone for just the beginning of this year, and he's been doing remarkably well. Desert Flower Sierra Leone, a brief background about it is that it's an idea that was born from a model called Wari Dere, and a Somali-born model actually, and she's based in Austria. Father Peter Konteh has been working with her recently because Sierra Leone happens to be one of the places where FGM, female genital mutilation, is practiced in high numbers, and he thought he could work along with Waridere to basically educate young women and their families about the dangers of female genital mutilation, also known as circumcision. And we're here in his office to find out what are his work around gender-based violence in general, in addition to female genital mutilation. Also, we'll be having a quick interview with him about the current situation in Sierra Leone, which is the Ebola infection. We've had this infection just about 3 months, and there has been a toll of deaths in the country, affecting the economy, the social structure, and everything else. At present, we're in his office, Reverend Father Peter Konteh's office, and we want to have a quick chat with him, ask him a few questions in relation to his work. Hello, Father Peter Konteh.
Hello, good afternoon, brothers and sisters. I'm the president of Desert Flower Sierra Leone, and I'm sure most of you are aware about the story of worries and the activity of Desert Flower. Sierra Leone was identified as a country which have one of the highest genital cutting in the planet, and we are 94%. And so they choose Sierra Leone to be a place where they could operate, and we started quite recently. But unfortunately, just as our operation was taking off, our country has been faced with an Ebola crisis, which you are aware. And most of our girls are safe, personally, but yeah, the environment has been affected, and schools are closed, and everything seems to be shut down at the moment.
Okay, moving forward from that, Father Peter Konteh, I know you've been working with the girls in the country, all around the country, and you've been sponsoring some of the girls in school and throughout their social problems. I just want to ask you, how many girls do you look after presently under the Desert Flower Foundation Sierra Leone?
Yeah, we set ourselves targets. For this year, we are targeting 1,000 girls to be registered, but already we're in contact with 600, and 400 have already signed the contract, and they have now sponsors that sponsor them to help them in education and some support within their families, so as to ensure that they are not forced to circumcision, to ensure that they are educated, to ensure that they are empowered.
Right. Now, with the outbreak that has just started, as you begin your sentence with talking about the Ebola problems around the country, I was just wondering, how are the girls doing, considering the dangerous circumstances they're facing at the moment? They're very much exposed, they're the least marginalized, and so on. What exactly is their current situation?
Shortly before this interview, I was in contact with our social workers who are also living in the communities, various communities, which we have the Little Desert Flowers, and just to get an up-to-date report. They are all alive, thank God, but many of them have been affected. Families have died. One of them, particular Christiana, she's lost 7 members of her families because they were from Kailaun, and they are now living in Allentown, but all her relatives are dead. In one family, they lost 7. So they are affected because they are shut down of schools, nothing is happening, and the girls are home. And so our social workers are still out to see how they are doing, and also do some little sensitization in these communities. because the Ebola has escalated, because initially there was a lot of denial. But after the death of one of our leading doctors, there is a transformation, a total change of mind, and people are accepting now that Ebola is real. And so we are doing the sensitization in these our targeted communities, which our little desert flowers are living.
Oh, that's very good. Moving on from that, what measures are you doing to protect the girls and of the girls of the desert flowers, and what preventative measures are you putting in place to stop the contagious disease from spreading?
We are, as I said, deploy our social workers to give basic hygiene materials. When the schools were on, we supply bucket and Dettol and chlorine so that they could be washing of their hands. But now they're in families, so all we do visitation, we're in contact with them, we pass on the message. We have engaged few community radios, which our girls are, the communities where we have our girls. So in the community radios, we have discussions about how they should go about and what they should look about, the symptoms, what they should prevent. So we are doing little sensitization, which is not enough though, just to help prevent our girls and keep them safe.
Right. I understand the school system is shut down at the moment. The children, the girls are on holiday, and from sources, it said the school was supposed to open in September, and that's going to be postponed. What other activities are you planning for the children now that school is going to be postponed to reopen, because they need to be engaged in something? And what are the things you've put in place for them to be occupied?
Well, as a result of the fast spread of the Ebola, our government has declared the health emergency, and there are a lot of implications about that, and the number of people that could meet at a particular time and so on. So there are a lot of consequences in declaring a health alert in the country. And so what we do, we check on the girls that they are still keeping up to reading at home, and that they are not, doing things that will bring up this Ebola and transmit this Ebola in their communities. Very little could be done in terms of getting them together. We are trying to organize workshops for parents, the parents who have signed up for their kids, to educate them on basic things, basic hygiene, and so on, so as to ensure that our girls are safe.